Well, the Tennessee Department of Health issued nursing home visitation guidance this week that offers a clear glimmer of hope for bringing loved ones back together. And Jeff Keeling has been tracking COVID's impact on nursing homes and has spoken with doctors and others in this industry this week to learn exactly what that means. So Jeff, tell us, are folks going to be able to see their loved ones anytime soon?
Well, you know, there's a lot to unpack here, as there always is. When COVID is the issue, it's really all about numbers and trends. But, you know, I think things are looking good, and we could see something happening soon at some of these facilities at least.
That is great news. So take us through some key issues and some numbers that we're seeing here in our region.
Yeah, well, I'd say the key issues are really at least twofold. First of all, long-term care facilities take their main cues from the Centers for Medicaid Services, a federal entity. The state's guidance is great, but, you know, even the state said you need to continue following those federal guidelines as well. So the key points here include visitation can't be opened until a facility isn't conducting COVID outbreak testing and hasn't had a new case in the last 14 days. Also, if you look at this chart, it shows the weekly totals of outbreaks in Northeast Tennessee facilities. That's a lot. That's a lot of facilities that have had outbreaks. You go all the way back to December 11th. It was rising slowly but steadily until mid-January. It hit a high of 35 on January 22nd. They report each Friday to the state, and over the last 4 weeks it has declined a whole lot. It's about a third of what it was 3 weeks ago. So that's good news. At least it looks like we've got some facilities that are getting out of the woods in that regard.
Trending downward, that is a really good thing. Okay, so the trend is looking good. Are these 13 currently not able to open to visitation then? Is that what this is saying?
That's my interpretation of the CMS rules. And also then another thing is positivity percentage. Any county that has a positivity percentage in the CDC red zone, which is above 10%, they can't open to visitation. And you look here right now, we've got 3 counties, Sullivan, Unicoi, and Carter, all above that threshold. Hawkins is close to it, but then Washington and Greene and Johnson are all pretty well below it. The good news there is that those rates region-wide have been going down a lot. They were above 25% in early January, and they were below 10% as a region last week.
All right, it sounds like CMS is being pretty cautious about this, and rightly so, considering what's going on right now. Could it still be a little while for some of those people to be able to interact with their families?
Yeah, I mean, it really could. You know, our regional health director, Dr. David Kershke, put it to me this way not too long ago. He said, with respect to COVID precautions, first, make sure bear is dead, then put gun down. And I think that CMS wants to keep that weapon out there as long as it thinks it should to really minimize the possibility of new outbreaks, more suffering, and more death, honestly. And, you know, that's a wait for a lot of people. I know that's hard, but that's just the way it really needs to be.
Right. You're wading through a lot of numbers here and putting this into perspective for us, which I really appreciate because you could really get lost in it. Tell us about trends, deaths, things like that.
Let's take a look here. You know, so we've got the previous 5 weeks, the last 5 weeks we've had low numbers. That's in the orange. The 5 weeks before that, this is new resident cases. There were 373 new cases in Northeast Tennessee among residents. That dropped all the way to 64 in the next 5-week period. Same thing with staff, not quite as much, but still it's less than half from the 5 weeks before. So those are tremendously good trends. And the same is true really with deaths, which is very fortunate. And we've got some numbers on that too, if we've got time. So
there we go.
We've got a graphic here, and this is really the best news of all. You look at mid-December or early December through mid-January, 76 deaths related to COVID outbreaks, only 13 the last 5 weeks.
Definitely a trend downward. We don't want any, but this is certainly a step in the right direction as far as this goes.
It absolutely is. And, you know, people are really wanting to get into the homes to visit their loved ones. I think, again, caution is going to be the word of the day, and they're going to want to keep that, get that bear completely incapacitated before they let anybody in to see their loved ones. But it looks like the trends are all looking very good.
Grandparents, great-grandparents are, I'm sure, all waiting as well as people on the other side of the wall here.
Absolutely.
All right,
that's right.
You can read more on this. Jeff Keeling's story is on our website, WJHL.com. Jeff, thank you so much.
Thank you.